this episode of True Abutment Interview.
Hey everyone, I'm Rachel and you're watching InTruView.
Phoenix, Arizona, where you're surrounded by beautiful mountains, great weather year-round, a golfer's paradise, and home to TruSmile Now. I'm Jeff Kraft, and on this episode of True Abutment's Interview, we're going to chat with Dr. Choi and Dr. Jensen. Their philosophy? Treating people, not just smiles. Let's find out more. This is really a great medical complex overall. In the office, this is actually beautiful inside of here. Hi, how are you?
Hi, hello.
I'm here to see Dr. Jensen and Dr. Choi.
Alrighty, thank you for walking into TruSmile Now. I'll go ahead and introduce you to Dr. Choi.
Okay, great.
Dr. Choi, this is Jeff.
Hey,
Dr.
how are
Choi,
you?
how are you?
Good, nice to meet you.
Nice to meet you as well. You and I, we're going to be sitting down and chatting in just a little while. I want to find out more about you and your history, and along with Dr. Jensen.
Okay.
Perfect.
Sure.
Speaking of Dr. Jensen around?
Yeah.
He's right over here.
Perfect. I'll see you in a bit.
Okay.
Dr.
Welcome into
Jensen.
the office.
How you doing?
Great
Nice to meet you.
as
Nice
well.
to meet you. So you and I were going to be chatting in just a little while. I
All
just
right.
met Dr. Choi.
Yep.
Well, I'm going to bring both of you together. I want to find out more about your practice.
We'd
and
love
just
to talk to
more
you.
about you guys.
Excellent.
Awesome.
Very good.
Let's keep going.
Okay.
Let's walk around. Guys, thanks a lot for bringing me in, allowing me to come in and sit down with you. Want to find out about your background now. Want to find out how you guys got involved in the dental industry. Dr. Jensen?
Sure. Well, I think the simplest answer is I come from a family of dentists. My dad's an oral surgeon.
You were born into it.
Kind of born into it.
Yeah.
Yeah. And it's something that I've really enjoyed doing. Love dealing with patients on a day-to-day basis, forming relationships, helping patients get out of pain and restoring their smile. And it's just something that kind of, I think, came natural to me.
Yeah.
So it's been good so far.
How is it having a dad he's an oral surgeon?
He is, yeah.
How is it having a dad as an oral surgeon in the dental industry? Are you trying to match how great he is, or do you feel like you've already done that?
Jeff, that's a great question. I mean, there is a part of me that wants to make him proud.
Yeah.
But I grew up working in his office. I grew up, kind of seeing how the business was run and took a liking to it just because I was around it and exposed to it.
Okay.
I don't think that's different than many people who maybe follow in their parents' footsteps.
Is he still practicing?
He is, yeah.
Oh,
He still
how
is.
come you don't
Getting
work with
close
him?
to retirement. Well, he practices in Illinois.
Oh, I didn't know.
My wife brought me out
Have you
here,
two
so
met
here I am.
What's your story, Dr. Choi?
Well, to be honest, I don't even know how I ended up here. In my college year, I was on this side major, and one day my counselor came to me and, hey, you're graduating next year. You gotta choose your major. And I was like, I don't know what to do yet. And he's like, do you like a business better or science better? So I told him I like a science better.
Okay.
Do you like to teach people, or do you work in the lab, or you want to treating people? Like, I don't want to work in the lab. I don't hate teach people, so I'll probably just treating people. So I say, okay, I'll go to dental.
So she laid it out for you, like
Yeah.
just you gotta
Yeah.
choose something.
Yes.
What is it you do? What are the practices? TruSmile Now. What do you offer here at the office?
Well, we're more of a comprehensive restorative practice, usually with dental implants, helping patients replace, all their missing teeth or some missing teeth. It's a little bit different than general dentistry, doing fillings or crowns and bridges, things like that. We do that, but we're more focused on, restoring the whole smile and the patient's confidence and self-image.
I saw on a website, heard that the grapevine, I guess you can say, is your philosophy, the philosophy of both of you. You treat people, not just the smile. It's really about the people, isn't it?
It is, yeah, absolutely. Patients come in with their own fears and uncertainties and discomforts, and part of being a dentist is meeting that need, not just treating the problem, but in taking into consideration the entire patient's feelings about what they're going through. And I think we do a really good job of that here.
Yeah, it's more like changing life
Yeah.
than just teeth.
Yeah, and it one hour, you can change an entire person's outlook. They walk in, they're maybe hunched over, and they walk out chest up and just proud. That's a pretty powerful position to be in. It's exciting. Let's put ourselves in the patient's shoes. And when a patient walks in, what is the most important factor in your mind for a patient to decide which dentist to go with? What do you feel like is the most important factor?
I think if I was a patient, when I look for the dentist, I'd probably look for the dentist who hears more than talks to me more out of it.
That's a great point.
I think that's really important.
Yeah, same thing for you?
Yeah, I mean, there are many dentists who are well qualified and competent and experienced, and you know, we think of ourselves as all those things. But finding a dentist who listens, who you feel confident in, who exudes trust, I think those are all, you know, really important considerations for a patient.
Yeah, trust is important. I trust a dentist will not hurt me.
Sure, yeah,
because pain is a big thing.
That is a huge consideration for many patients.
Yes.
And it's also fear.
So how do you handle that with patients?
Well, I mean, every action you take with a patient, you develop a certain level of trust, right?
Okay.
You know, how you talk to the patient initially, how you listen to them.
And with this kind of a treatment, like a full mouth reconstruction and stuff, you're kind of marrying with that patient. You know, it's not like one time and done.
Sure.
You keep going. You have a relationship with them forever, kind of. That's how I tell the patient.
I like that. That would make me comfortable walking in, saying this is going to be, we're going to get to know each other over a long period of time, not just me fixing you and then you leave and not come back. That's great. I like that. All right. So you guys grew up with, you know, families.
Sure.
You have kids?
No,
I do.
You do?
I have a daughter.
You guys play games, right?
Absolutely. Who doesn't like a game?
We're going to play a game.
All right, let's do it.
So we have brought an impressive technology with us today.
The spinning wheel.
The spinning wheel. So Dr. Choi, what I'm going to do is I'm going to have you spin the wheel, whatever color it lands on. I'm going to let you know what the game is that we're going to play. And it's going to be a battle between you two, and you're going to incorporate your office staff. You guys down?
Let's do it.
All right.
And if Dr. Han's ready, I'm ready. Pat, say Jack.
That's right. All right, so let's see where it stops. It is going to go with, okay, so that represents family. So in your office, who has the biggest family in your office with brothers and sisters? So the most brothers and sisters in the office. So what you're gonna have 120 seconds to run around the office, and you've got to determine, you're gonna talk to how many you can, you're gonna talk to how many you can. Starts now.
Go.
Brothers and sisters.
Brothers and sisters. Karen, Louise, where are you? Karen, how many brothers and sisters do you have? None? Are you serious? You're an only child? Look, I learned something about Karen I didn't know. Where's Louise?
Louise, how many brother or sister do you have?
Oh, Hans, bring me to it.
I'm only child, actually.
You're the only child?
Yeah,
Only child? How many cousins?
cousins like 50.
Oh, 50.
Hey, Jesus, how many brother or sister do you have?
Is it a trick question?
No, it's not a trick, it's just a trick question.
Okay, I have 2 brothers and 1 sister.
Okay, that's 3. And it's so far the winner.
Yeah, so currently,
Come on.
Lion, how many brothers and sisters do you have?
I just have 1 brother.
Just one. Everyone comes from a small family around here.
How many brother or sister do you have?
4 brother
4 brother.
and 4 sister.
4 sisters. So that's 8.
Yeah.
All right, we got the winner here.
Only child, Karen, but you have 1 son.
1 son.
1 son. I knew that. See, there are some things I know about my team.
all right. So I think we have a winner. And Dr. Jensen, it's not you. So what did you find out?
So Mawan has a 4 brother and 4 sisters.
Yep. 8.
There you go.
So since you won the game, you like
right.
gifts?
Yeah.
You like it? Perfect. Well, we got a gift for you.
That's pretty big.
It's
All
a pretty
right.
big gift. Now, this is
take it.
actually an
I'm
office
jealous.
gift. It's an office gift for allowing us to come in here, find out a little bit more about you, find out about the staff, your practice overall. So appreciate you guys letting us come in here. So this right here,
Let's see what it
All
is.
up to
Open
you.
it.
Rip it up. There's no right way, no wrong way.
This is massage gun.
Everyone sign up. It's a good
Send up the
time
line.
slot.
Thank you.
Oh, that's great.
Guys, thank you so very much. Appreciate it.
You
Hopefully
need
you
this
enjoyed
after a long day of dentistry, trust me.
That's right.
That's great. What are you ordering?
Godfather, I think everybody
Choi, Dr. Jensen, thanks a lot. I appreciate you guys letting me come in and explore your facility, and it's beautiful here.
Thanks, Jeff. We enjoyed having you.
Thank you for coming in.
I know you guys are busy, so I'll let you guys get back to it.
All right.
Thank
See
you.
you later.
All right, see you guys. Well, there you go. There you have it. Another successful interview. Join me next time as we introduce you to more dental professionals all over the country. I'm Jeff Kraft. See you then.